Okay, we're gonna go over a PIR, right transverse contact Blair adjustment. First we'll talk about the x-ray analysis, and then I'll get an atlas and we'll go over the biomechanics of what's happening in there. And then we'll transfer that over into side posture on the table and go over the angles that you need, your carpal angle, your stance line, and what contact you're going to use for this particular adjustment. So let's go over to the x-ray. So there's two angles that you're going to need in a PIR, and the first one comes off of the base posterior. So we've got the right convergence here, left convergence here, and in a PIR the vertebra's traveled backwards along the right convergence angle. So in this particular case we're going to use a 34-degree convergence here. In the second angle you're going to get off of the left Blair view in a PIR. And remember, when we're looking at the left Blair view, we're looking down the longitudinal axis of the left joint. And in a PIR, you're going to see an underlap. So the left lateral mass, that lateral tip of the lateral mass of atlas is going to shift under on the skull here. And so remember, on the left Blair view, you're going to pick up the right convexity on the left Blair view, which is right here. So what you're going to want to do, you're going to measure the last 1/3 of that joint, which is right in there, so around 29 or 30 degrees. So we got the right convexity here at 29 degrees, and again the right convergence at 34. So now, in a PIR, you're looking at this vertebra petae just like you are on an x-ray film. We got the right convergence here. It's traveled longitudinally backwards along the right convergence, and it's underlapped on the left joint. So we've traveled backwards along the right convergence. We've gone under on the left joint. Again, just to review, you need the right convergence and you need the right convexity. So we'll go over onto the table and we'll see what this looks like in side posture.
PIR.
So we're going to place the patient on the table. Their right side is up, so their nose is facing this direction. The back of the head is this way. And here's the atlas articulating to the head. This is the right joint. And it's when this vertebra has traveled out of position, is moved along this convergence and this convexity back into the right like this. So the right convexity was 29 degrees. We're going to place the protractor on the table above their head. You're going to be standing posteriorly on the back of them, and that convexity is your stance line. So you want to stand shoulder length apart with the feet along the right convexity, and we are making a posterior superior contact on the transverse process of the atlas. So you're going to palpate where that is with your finger. You're going to take a tissue pull from posterior to anterior and from superior to inferior on the transverse. And you're going to use your left pisiform contact on the posterior superior part of the transverse process. And the other angle you're going to use is the convergence angle, which in this case was 30 degrees. That's going to be your carpal angle. So set your protractor to 33 degrees after you've made your contact on the transverse, and have the zero line of the protractor horizontal to the ground, and you're going to modify the carpal angle based on that convexity again, which in this case is 30 degrees. That's that right there. Your upper back should be flat, not rounded. This is a straight toggle adjustment. So the upper back should be straight. Come in with the hammer hand right into the anatomical snuff box. On this particular adjustment, the right thumb should be wrapped around the ulna. And then it's just a straight toggle recoil adjustment that looks like this.